You know, trying to stay genuinely informed about healthcare, it really feels like a constant effort, doesn't it?
Oh, absolutely.
Between all the new tech, the regulations changing, best practices evolving, it can, well, a bit much sometimes.
It really can.
So that's exactly why this deep dive is focusing in on something really vital: quality performance improvement in healthcare, QPI.
Mm.
Think of this as maybe your shortcut, getting to the heart of how healthcare organizations are actually working systematically to improve patient safety, the quality of care, and, efficiency too.
Exactly. And we've really dug into a pretty comprehensive guide on QPI. We looked at stuff incorporating the latest thinking regulations right up to 2025.
Okay.
The goal here is really to distill it down for you, give you a clear picture of what makes a modern quality performance improvement plan actually tick its key parts, the principles behind it,
Yep.
without getting totally lost in the weeds.
Right, just the crucial bits.
Yeah, we want to highlight what really moves the needle on
Yeah.
patient outcomes and, how effective the care delivery actually is.
Okay, sounds good. So where should we start? Maybe with how information actually flows inside a healthcare organization.
That's a great place to start.
It seems kind of basic, but getting that information flow right, it's got to be absolutely fundamental for making good decisions quickly and giving the best care.
It is totally foundational.
Yeah.
And, as healthit.gov was pointing out back in 2024, the sophistication and maybe more importantly, the interoperability of electronic health records.
Right, making sure different systems can actually talk to each other.
Exactly. That's huge. But the real insight, I think, from the 2025 plans we looked at is this push towards more proactive information delivery, using things like AI to actually anticipate needs, not just reacting when someone asks.
Interesting. So it's not just about having the pipes connected digitally. It's about using them smartly to get the right info to the right folks exactly when they need it.
Precisely.
So what are some of the strategies the guide mentioned for actually doing that?
Well, it hits on a few key things. First, embedding clear protocols for information flow right into the organization's policies, like really defining who needs what info and by when.
Okay, making it official policy.
Yeah. And then really leveraging what the EHR systems can do. Things like automated alerts for critical lab results, maybe, or those real-time dashboards showing key performance indicators.
The KPIs, yeah, so you can see trends easily.
Right, those crucial metrics that tell you how you're doing.
Makes sense. Build the pathways, use the tech. What about timing? That seems critical too.
Oh, absolutely critical. The guide really hammers home setting clear timelines for sharing data. Think about daily safety huddles, quick meetings where frontline staff share vital patient updates.
Right, immediate needs.
Exactly. Or maybe weekly quality reports that give you that broader, more strategic view. And of course, none of this works if the staff aren't trained properly. They need to know how to actually use these data tools.
Yeah, that makes sense. It's a whole package, isn't it? Clear policies, the right tech, set schedules, and people who know how to use it all. Now, I think I saw something in the sources about AI helping with this flow.
Yes, definitely. There was a 2024 study, I think, in the Journal of Healthcare Management that gave a really powerful example.
What did it find?
They found that hospitals using these AI-driven data triage systems saw a pretty significant drop, like 30% in communication delays.
30%. Wow.
Yeah. And what's really fascinating is they saw a direct link between that better information flow and improved outcomes for patients in critical care. So it's a really tangible example of why getting this information piece right is just so vital.
Absolutely. That 10% really hits home. Okay, so if the information is flowing better, how is it then, captured and shared to actually drive improvement? Let's talk about reporting routines.
Right. So structured reporting is basically the engine for tracking progress on all these improvement efforts. As CMS Centers for Medicare and Medicaid Services emphasizes, these reports need to be, well, concise, but more importantly, they need to be actionable.
Not just data dumps.
Exactly. They're not just for the record. They have to give people the insights they need to make decisions and actually drive change. And interestingly, the 2025 QPI plans we looked at are starting to move beyond just reporting what happened.
Oh, how so?
There's a much stronger emphasis now on building predictive analytics into the reports, so you can potentially intervene before something goes wrong. That's a big shift from previous years.
Okay, proactive again. So what makes for a really effective report in this context? What should be in it?
The guide points to a few key things. Ideally, you're looking at concise summaries, maybe one page, that clearly show those KPIs, the trends over time, and then specific action plans based on what the data is showing.
Got it. KPIs, trends, actions.
And this info needs to get out securely, digitally, to the right people, leadership, staff on the floor, maybe even the governing bodies.
And how often should these reports go out?
Typically, the recommendation is regular cycles, like monthly or quarterly. Keeps the focus there, ensures you're constantly monitoring progress.
Makes sense.
And the guide also mentions best practices, like using data visualization tools, Tableau, things like that, to make the data easier to grasp.
Right. Charts and graphs are easier than spreadsheets sometimes.
Definitely.
Mm.
And crucially, bringing in patient feedback metrics too, making sure the reporting connects back to the whole point,
Mhm.
patient-centered care.
Yeah, that complete picture, the numbers and the patient experience. Okay. Now, this idea of embedding quality principles deep into the organization, that sounds really fundamental. How does that actually work?
It's really about making sure quality improvement isn't just some side project, you know. It needs to be baked into how the organization runs, top to bottom. The Institute for Healthcare Improvement, IHI, they've been big on this for ages. Deep integration helps cut errors, boost patient safety.
So, what are the actual steps an organization would take to do that, to embed those principles?
Usually it starts with a really thorough look at their existing policies.
Mm-hmm.
Where are the gaps? How is quality addressed now or not addressed?
Okay, a policy review.
Then they revise those policies, bring in evidence-based practices, maybe frameworks like IHI's triple aim, better care, better health, lower costs, and the latest research.
Right.
These updated policies, of course, need formal sign-off, admin, medical staff, the board, everyone needs to be committed. And then maybe the most important part is ongoing monitoring. Are people actually following the policies? Are they making a difference?
You mentioned something about AI coming into play here, too, a recent development.
Yeah, it's quite interesting. A 2025 IHI report highlighted some really promising stuff. They're seeing that integrating AI-driven predictive analytics directly into quality policies. Well, in pilot programs, it led to a reported 15% drop in adverse events.
15%, that's substantial.
It really is.
Mm-hmm.
It suggests that this sophisticated tech is starting to play a much more direct role in shaping quality right at the policy level. The 2025 plans show more use of machine learning to analyze patient data, spot higher risks earlier, and allow for targeted prevention.
Very cool. Okay, so you've got policies, you've got tech, but ultimately it comes down to the staff, right?
Yeah.
Their knowledge, their skills. How do organizations make sure their teams are actually proficient in all this quality improvement stuff?
Yeah, absolutely critical. That's where educational needs assessments come in. You have to systematically figure out where the knowledge gaps are.
How do you do that? Surveys.
Surveys, focus groups, yeah.
Yeah.
Talking directly to staff, finding out what training they feel they need, especially around QI methods like Lean, Six Sigma, that PDSA cycle we mentioned, or risk management, utilization management.
Okay, find the gaps. Then what?
Then you build targeted training. Could cover anything from basic patient safety to complex data analytics or understanding new regulations. The key is using different methods, e-learning, simulations, workshops. A blended approach usually works best.
To suit different people and schedules.
Exactly. And then you have to evaluate if the training actually worked.
How do you measure that effectiveness?
Well, the guide talks about 2 levels. Right after training, you can do quizzes, tests, see if they retain the knowledge. Short-term impact.
Okay.
But the real test is long-term application. Are those KPIs actually improving? Are error rates going down because people are applying what they learned? That's the true measure.
Right, it's a continuous loop. Assess, train, measure the real impact. Okay. Now, we've mentioned quality, risk, and utilization management a few times. They sound related. Are there specific plans organizations need for each?
Yes, absolutely. Whether they combine them into one big document or keep them separate, having dedicated plans for quality, risk, utilization, and patient safety is pretty much essential. It's needed for their own goals, but also to meet requirements from bodies like the Joint Commission, looking at their 2025 standards. These plans are basically the roadmaps.
Gotcha. And are there common threads, things you'd expect to see in all these different plans?
Definitely. The guide stresses they all must align clearly with the organization's overall mission and strategy. They can't exist in a vacuum.
Makes sense.
There also needs to be a formal approval process, getting admin, the governing body, the medical staff all on board. That ensures buy-in. And really important, these aren't static documents you write once and forget. They need regular review, updates at least annually, based on performance data and any new risks that pop up.
You mentioned physician involvement earlier, like with managed care plans. Why is getting different stakeholders, especially doctors, involved in approving these quality plans so important?
Well, it's about making sure the plans aren't just, bureaucratic exercises. They need to be clinically sound, practical,
Mm.
something that actually works on the ground.
Right.
When you bring in the people doing the patient care into the development and approval, you get crucial insights. Plus, it builds ownership. People are more likely to follow a plan they helped create. Leads to better execution ultimately.
Okay, so those are the individual pieces. Let's zoom in now specifically on the Quality Performance Improvement Plan, the QPIP. What's its main purpose and scope?
Right, the QPIP. It's essentially a data-driven, hospital-wide program. It's actually mandated by CMS under Regulation 7482.21.
Ah, okay, a regulatory requirement then.
Yep. And its main goal is continuous improvement of patient health outcomes and really proactively reducing medical errors. It uses systematic, evidence-based approaches.
So, required, but also clearly vital for improvement. What are the absolute essential parts of a good QPIP?
Several things are really key. First, you need strong leadership engagement, buy-in from the top, but also accountability all the way down.
Okay.
Second, it absolutely has to be data-driven, using real-time analytics to track KPIs, benchmarking against national standards to see how you stack up
Using data constantly.
constantly. It also emphasizes that continuous improvement cycle, often using the Plan, Do, Study Act or PDSA model, testing changes, studying results, refining things.
Right, the PDSA cycle.
The scope also needs to be really comprehensive, covering all departments, even services that are contracted out. And finally, the goals themselves need to be based on evidence drawing on benchmarks, best practices from places like AHRQ, the Agency for Healthcare Research and Quality.
And there's specific rules about the QPIP document itself, right?
Yes, CMS requires hospitals to keep detailed documentation of their QPIP ready for review. It really underscores the need for transparency and accountability. You have to show you have a plan and you're actively working it.
Okay, so the QPIP is the big umbrella. Let's break it down further. What are the specific sections or elements you'd typically find inside a QPIP document?
Yeah, think of it like the detailed blueprint. It always starts with a clear purpose statement. Why does this plan exist? Usually enhancing patient safety, improving care quality.
Yeah, okay, the why.
Then it needs to explicitly link to the organization's overall mission and vision, making sure QI efforts aren't siloed from the bigger strategy. After that, you get into the specifics, the measurable goals and objectives.
Can you give some examples of what those might look like?
Sure. A clinical goal might be reduce hospital-acquired infections by 10% in the next fiscal year.
Okay, specific, measurable.
An operational one could be streamline the discharge process to cut average length of stay by half a day. And a strategic one might be something like implement AI tools for predictive risk assessment across all inpatient units by Q4.
Got it. Clear targets.
Yeah.
What else is essential in the QPIP structure?
Well, there's the planning section, how you'll actually achieve those goals.
Mhm.
Who are the stakeholders? Patients, staff, payers, community. How do you prioritize opportunities based on impact?
Right, the how.
Then infrastructure, what's the governance? Usually a quality council overseeing things, plus performance improvement or PI, teams working on specific projects.
The structure for doing the work.
Exactly. The plan also has to spell out the methodology. Lean, Six Sigma, PDSA, whatever they're using. Communication is vital, so how will progress be shared? Dashboards, reports. Confidentiality, making sure everything's IPower compliant. And finally, evaluation. How will the plan's effectiveness be reviewed annually? And who signs off? Leadership, the governing body, their signatures need to be on it.
That's a really thorough breakdown. Now, you also mentioned the risk management plan earlier. How does that fit in with the QPIP? Are they separate things?
They're related but distinct. While the QPIP looks broadly at quality and error prevention, the risk management plan is more focused. Its goal is specifically to prevent harm to patients, staff minimize losses, whether financial or operational, and basically protect the organization's resources and reputation.
More focused on preventing negative events and losses.
Precisely. And remember that 2025 Journal of Patient Safety study we mentioned, highlighting AI for proactive risk assessments, that's becoming a bigger part of modern risk management.
So what kind of activities does risk management typically involve?
Well, core things include investigating incidents, patient complaints, really digging into what happened, conducting root cause analyses, especially for serious adverse events, to find those underlying system flaws and fix them.
Learning from mistakes.
Definitely. And increasingly doing those proactive risk assessments, trying to spot potential hazards before anyone gets hurt.
And what would a formal risk management plan document usually contain?
Pretty similar structure in some ways.
Right.
A clear purpose statement, patient safety, reducing liability, specific measurable goals, like maybe aiming for a 15% annual drop in preventable adverse events.
Okay.
The scope needs to define which risks, clinical, operational, are covered. It outlines the authority. Who are the risk managers? What committees are involved? Crucially, it lists the data sources. EHRs, incident reports, patient feedback, claims data,
Where the risk info comes from.
right, and how it's monitored, risk dashboards, key metrics, and like the QPIP, an annual evaluation process.
Okay, quality, risk. That leaves utilization management. What's the core purpose of a plan?
Utilization management, or is really about making sure patients get care that's, one, medically necessary, and two, cost-effective. But this is key without compromising quality or patient outcomes.
The balancing act.
Exactly. It's a big focus for CMS conditions participation, too. It's about responsible stewardship of healthcare resources.
So making sure we're using resources like beds, tests, drugs appropriately?
Precisely. The goal is optimizing resource use, avoiding waste, unnecessary procedures or stays, while ensuring patients get the right care level, and importantly, that the hospital can actually get reimbursed by payers. A typical goal might be something like reduce unnecessary hospital admissions by 10%.
Okay. And what are the key components of a plan?
It needs to spell out the authority structure. Who oversees often the governing board sets strategy, and physician advisors give clinical input on specific cases.
Doctor involvement again?
Crucial for medical necessity decisions. It also outlines the core processes: pre-admission reviews, continued stay reviews, discharge planning, making sure transitions are smooth, and managing denials from Medicare, Medicaid, private insurers.
Handling the insurance side.
Yeah. Information management is key, often using EHRs to track utilization in real time. Confidentiality, naturally, is paramount. And again, evaluation, measuring the impact on both cost and quality.
It really sounds like managing quality, risk, and utilization effectively takes a lot of coordination and specialized know-how. What's the actual role of the professionals who work in these QRU areas?
They really are the driving force behind pushing for organizational excellence. They're the facilitators, the educators, the champions for all these continuous improvement efforts. They work across departments trying to build collaboration and accountability.
So what does their day-to-day look like? What are their main responsibilities?
A huge part is getting buy-in from leadership,
Mm-hmm.
engaging the board, the doctors, the administrators, finding those internal champions.
Building support.
Absolutely. And building relationships based on trust and open communication. That's essential for driving any kind of change. They're also the ones doing the deep dives, those organizational assessments, looking at past surveys, performance data, identifying where the opportunities are.
Finding where to focus efforts.
Right. Then they develop the detailed action plans.
Yeah.
Who does what, by when, making sure it all lines up with the overall strategy. Resource planning is big too, making the case for enough staff, the right tech, like data analysts or better EHR modules, and getting budget approval.
Making sure the resources are there.
Yeah, and clearly defining roles. Who owns what piece of quality, risk, or across the organization? Communicating priorities, effectively the mission, vision, quality goals, maybe new QI tools being rolled out, and often they oversee the actual implementation, planning for sustainability.
It's a really broad and critical role, and you mentioned something earlier about AI changing their role too.
Yes, exactly. That 2025 Healthcare Executive article really highlighted this. QRU professionals are becoming increasingly vital in actually leveraging AI, using it for sophisticated predictive analytics.
So they're not just managing processes, but interpreting advanced data.
Right. It allows for much more proactive, targeted interventions, spotting risks or improvement opportunities way earlier before they become big problems. It's a really exciting evolution for the field, I think.
Wow. This has been incredibly illuminating, a really deep dive into quality performance improvement in healthcare. It's
Yeah.
so clear it's this systematic, data-driven, constantly evolving thing.
It absolutely is. And it's all driven by that core commitment, right? To get better outcomes, more efficiency for patients. It really leans heavily on collaboration, on sticking to evidence-based practice.
Yeah. And like you said, it's so much more than just, ticking boxes or following rules. It feels like a genuine ongoing cycle of learning and improving and really trying to nail down excellence in patient care.
Couldn't have said it better myself.
It really makes you think. This whole structured approach, continuous improvement, data-driven decisions, it's obviously critical in healthcare where the stakes are so high. But could those same principles, that framework, apply elsewhere? In other complex fields, maybe even, I don't know, in our own lives? What resonates with you thinking about all this, about applying these ideas more broadly?
That's a great question. What really strikes me is just how universal those underlying principles are. Setting clear goals, planning systematically, using data to see what's working, fostering that culture of always learning.
Mm,
These ideas aren't just for healthcare.
right.
They apply across so many complex situations. Business, maybe science, even personal development, like you said. Healthcare, because it is so complex and so important, maybe provides a really powerful example of why you need this structured approach. But the basic logic, improving through informed action, that feels remarkably adaptable, doesn't it?
It really does. Well, we sincerely hope this deep dive has given you, our listener, a much clearer window into quality performance improvement in healthcare, and maybe, just maybe, sparked a few thoughts about how these ideas might pop up or be useful elsewhere. Thanks so much for joining us for this exploration.